Hello, everyone. This is Demetrius with Demetrius Dowdell Success Academy, and I am back again this Thursday to bring you your business tip for our Business Tip Thursday series. I'm very, very excited because today I'm bringing you something just a little different. I'm bringing you a very short PowerPoint because I wanted to be able to allow you to see the comparison between four of the most popular type of senior healthcare business models. Now, the four models that I'm going to present to you doesn't necessarily mean that they have to cater to a senior citizen or elderly type population, but um, these are the most common four that caters to the senior population. So I wanted to be very clear with this. So if you're thinking about going to business and opening in a healthcare business, any of these particular agencies, you can open and you can take clients as long as they are 18 years of age and older. Okay. The four that I specialize in is the senior care models. So the when I'm speaking to you predominantly from that perspective. But if you decide to open either of the four of these type of businesses, you can admit residents that or clients that are between the ages of 18 and older, okay, regardless of which state you live in. Now we don't get a lot into the pediatric population because that's a whole nother licensure process, but that also is an option that is available. But for us with Demetrius Dowdell Success Academy, we predominantly focus on our seniors. And making sure that you have what you need if you're interested in opening a senior citizen uh, type healthcare business that will service the population of 55 and older. Okay, so we'll be able to jump right in with you knowing that bit of information. We'll be able to jump right in to our next slide. As I stated before, two of the four senior care models that we're going to look at are considered as agencies. The first one is the Homemaker Companion Agency, and the second one is the Non-Skill Home Health Agency. Now, both of these type of agencies can cater to, as we stated before, ages 18 and older, but for us, we're going to be focusing on the senior citizen population, which is 55 and older. Okay, so for the Homemaker Companion Agency, this particular agency does not allow hands on care. Now, there is one exception to the rule, and it does vary by state. So you would have to check with the local authorities that is in your state that actually governs those types of licensures. And we're going to get into more of the licensure process on our next business tip. Thursday, we'll kind of break down the differences between the licensure boards and how you get licensed in your state. But for right now, understand that this particular agency is not hands on. You're not providing any hands on care unless you're in the state of Florida and you get exempted through what we call the agencies of persons of disabilities, which we'll talk a little bit about that more about that as I stated next week. The care provided is in the home, and you can also provide these services to other healthcare settings such as hospitals, skilled nursing facilities, um, things of that nature, they will also allow you to provide services, your agency to provide services with their company. This is one of the easier type models to start. Now, don't mistake easy to start as, a lack of responsibilities, because there is still a lot of responsibilities in that. There is still the healthcare plus the business perspective in order to make your organization run smoothly. But when we say easiest to start, what I'm simply saying is that the paperwork and the fees that is associated with it are not as stringent as the other three that we're going to talk about. This particular model provides companion shopping, light housekeeping, and it does not require an outside office space. So, in other words, if you have a designated space in your home, you can actually operate this particular agency from the comfort of your home. Okay, so that is what wraps up the Homemaker Companion Agency. And again, it varies by state. Some of the names and some of the startups and what is considered that you can do in each state may differ depending on the state. But for Florida, the Homemaker Companion Agency will fall basically under these particular guidelines. Now, the next agency that we are going to discuss is what's called the Non-Skill Home Health Agency. Now, this particular agency does fall up under a home health agency for the state of Florida. But what it does is there's two separate kinds. There's a skilled and a non-skilled. The non-skilled is what we will focus on in this particular for my particular consulting firm, because this is the one that deals with the personal care, where you can provide personal care without having to have a special exemption from a company or organization, excuse me, an organization such as Agency for Persons with Disabilities. Now, again, this is here in Florida. Each state has different guidelines. So, depending on which state you are going to be licensed in, typically you may not need an exemption for this particular home either. But here in Florida, you do not need a special exemption. You are able to provide personal care from to private client individuals or persons with disabilities. It can fall under both of those categories, and that you don't have to differentiate between the two. So at this point, the care provided is provided in the home and other healthcare settings, like we said, such as a hospital, some of the skilled nursing facilities may, allow you to provide some of those services with them. Now, this one is challenging to start up. Challenging does not mean that it is impossible. Challenging just means that it is a little bit more paperwork that goes along with this. There's a little bit more in-depth details that the state is going to require for you to license this particular home, and the startup cost is more than what the Homemaker Companion Agency typically is. But it is a good business, well worth starting if that's something that you're interested in. It provides all of the services that a homemaker companion agency provides. Plus, it also allows you to provide personal care without having to separate or get extra extensions from from a licensure standpoint in order to be able to operate. And this one does require an office space outside of the home. So if you are thinking about opening this type of agency, if you're thinking about opening this type of agency, you will need to find a designated office space that is outside of the home where you will be able to operate during normal business hours, so that you will be able to, handle all of your staffing needs, as well as the influx of um, traffic flow that may be coming through there, since you are providing a little bit more service than what the Homemaker companion agency requires. The last two models that we're going to look at is considered as facilities. Now, these two, one is the adult family care home, and second one is the assisted living facility. Now, with these two particular models, these two are typically where you are responsible for the client 24 hours a day. So they live in a residential home or a facility, um, where you're taking care of them, you're providing staff to take care of them around the clock. Now, with the adult family care home, it is a home like environment. Both of them, which the adult family care home and the assisted living, both are home like environment. The difference with that is the adult family care home can only go up to a certain uh, amount of beds that can be licensed. So it is a smaller of the scale when it comes to home like environment. And an assisted living facility can go up to however many beds the location is licensed or zoned for. So it can still, both can still present a home like environment, but one is especially capped off and can never go over that size of the licensure beds, and the other can go up to however many beds depending on the area and the location that you have zoned. And so that's the difference with the home like environment. Now, for the adult family care home, the administrator must live in the home. There is no other way around it. The administrator, or sometimes we call them providers, and they're interchangeable, must live in the home. Now, this is for Florida. Again, some states may vary, but for Florida, they must live in the home. As we stated before, it is a small group setting, and the max that you can be licensed for is 5 beds. That is the maximum that your home can ever be licensed for. And this particular home does provide personal care, medication assistance, activities, meals, transportation, etc. It is a 24-hour responsibility. They do live in the home with you, and you do hire staff to come in to provide these services for them. The last one is the assisted living facility. Now, as we stated, we pretty much cleared up that both of them can be a home-like environment and what that qualification meets. But the administrator has the option of whether they want to live in the home or not. I can tell you based on experience that most of the time in an assisted living facility, the administrator does not live on site in most case scenarios. They do not live on site, especially when you get into the larger facilities. Now, when you're looking at some of the ones that maybe a 6 bed, that is even still rare that the administrator would live in there. So on most of the cases, the administrator does not live there, and they are not required to live there. Okay. Um, as we stated before, that is a larger group setting, and the minimal amount of beds that you can license for is usually 6, and it goes up, as we were talking about earlier, depending on where you're zoned, the county, and the state that you live in, and as to how many maximum beds that your facility can be licensed for. Um, and again, this home does provide personal care, medication assistance, activities, meals, transportation. And again, you are responsible for clients or or residents on a 24-hour basis. The staff will be coming in to take care of, the residents. So I'm really hoping that the breakdown of these four different type of senior care business models is very helpful in helping you to make a decision on exactly which type of business that you would like to, start in the healthcare. As I said before, you can cater to clients anywhere from the ages of 18 and older. But Demetrius Dowdell Success Academy, our focus is on the senior citizen population and building those businesses that cater to individuals that are 55 and older. But the startup and the concept with being able to open either of the four of these businesses is the same regardless of the age group. It is the same. You have to go through the same process, the same licensure period in order to get your healthcare business properly licensed in the state that you live in. So I hope this was helpful. If you have anything such as comments, or if there is anything that you would like to see me review on the Business Tip Thursdays, I will be more than happy to take, comments. You can inbox me on our Facebook page, which is Demetrius Dowdell Success Academy. You can also go to our YouTube channel, which is also Demetrius Dowdell Success Academy on our YouTube channel, and you can leave comments on or suggestions on things or topics that you would like to hear discussed on the Business Tip Thursdays. We do welcome those, and we will review those to make sure that those are some of the topics that that we can cover for you and look at giving you success tips on that. So this concludes our Business Tip Thursdays. I really hope that you enjoyed that breakdown. And I'll be back again on next Thursday to bring you another business tip from Demetrius Dowdell Success Academy. And don't forget to like and follow us on Facebook. You can also follow us on Instagram at DDS Academy on our Instagram. And you can also, don't forget to like and subscribe to our YouTube channel, which is Demetrius Dowdell YouTube channel. Demetrius Dowdell Success Academy YouTube channel. Thank you very much and enjoy the rest of your week.